Hi, welcome to DTV. My name is Millie Hughes, and I'm Education Outreach Liaison at Doylestown Health. With me today is Alyssa Stalker, registered nurse, and our heart failure coordinator. Hi, Alyssa, how are you?
I'm good, Millie. Thanks so much for having me.
Thanks for being here. Can you tell us a little bit about yourself and what you do here at the hospital?
Sure. I'm a registered nurse. I've been working at Doylestown Hospital since 2013, and I transitioned into the role of heart failure coordinator in 2021.
Okay, so you've been working as a nurse for quite some time.
Yes.
And what made you decide to focus on heart failure?
I've worked mostly in cardiovascular nursing and cardiovascular health. I enjoy patient and family education, so this role as heart failure coordinator allows me to incorporate my love for patient and family education, evidence-based care, to provide the highest quality care to our heart failure patients in the community.
That's great. I'm sure you get a lot of questions about how someone with heart failure can live. I mean, that name is a little bit deceiving, but a heart is not actually, has not completely failed just because someone has heart failure, right?
So, heart failure, in the most broad sense, it means that the heart is not pumping as effectively as it could. It's unable to keep up with the body's demands. Heart failure is a chronic, progressive condition, and many Americans are living with it.
So I'm sure we'll get into what a heart with heart failure looks like, but can you tell us a little bit about, or maybe even show us what a normal heart looks like and how it works?
Sure. So, our normal heart, there's an image on your screen. We have a total of 4 chambers in our heart. Two of the top chambers are called the atrium, so we have a right and left atrium, and then our two bottom chambers are called ventricles. We have a right and left ventricle. As blood returns to the heart to get oxygen, it comes in the right side, it moves through your heart valves, out into your lungs from your right ventricle, then it gets oxygenated in your lungs, comes back to your heart on the left side, moves through the atrium, your valve, and your ventricle, and then moves out to the rest of the body. So electricity is sending impulses throughout the heart to allow it to contract or pump and then allow it to relax. So this image, you can see the left side of the heart is pumping strongly and the heart muscle is thick. Now we'll move on and show you what a heart with heart failure may look like. There's many different types of heart failure and reasons that the heart may be ineffectively moving blood through the body. So for this example, you can see on that left side of the heart, the bottom chamber, the ventricle, has gotten larger and the muscle is now thinner. So it's slowly weakening and that space is getting larger, so it's becoming even more ineffective in pumping the blood around your body.
You spoke about different types of heart failure. What are those types and how are they different from one another?
So there's multiple classifications of heart failure. One way to base them is using that left ventricular ejection fraction. So that is the percentage of blood that the left bottom chamber, the ventricle, is pumping out to our body with each beat. So as you can see on the slide, there's 3 classifications depending on what your ejection fraction may be. So the green bottom one is if your ejection fraction is 50 to 70%, and you have heart failure, it would be considered heart failure with preserved ejection fraction. If you are in the middle section, so that orange color, and your ejection fraction is 41 to 49%, that's heart failure mildly reduced ejection fraction. And then the one on the top, if your ejection fraction is less than or equal to 40%, that's considered heart failure reduced ejection fraction. Depending on what type of heart failure you have and your other conditions and health history, will depend on the treatment plan.
So, for any or all of these types of heart failure, are there risk factors associated with them?
Yes, so we have non-modifiable risk factors, which would be age and family history or genetics. You can't control those things.
Are there risk factors that people can control? I guess they would be modifiable risk factors.
Certainly, we have a lot of modifiable risk factors, things that people can control, conditions in their medical history. So if you have high blood pressure, high cholesterol, type 2 diabetes, coronary artery disease, obesity or you're overweight, you have sleep apnea, you're a current smoker, or you're drinking alcohol or using drugs in excess, something we'd call alcohol or drug abuse. If you have any of those things or are smoking or using alcohol or drugs, those can put you at a higher risk for developing heart failure.
The one risk factor there that stands out to me is the alcohol use. A lot of people drink socially or, in moderation. Is that a problem, or is there a right amount of alcohol to have?
So too much alcohol can lead to some types of heart failure. It can be contributing factors. The American Heart Association recommends that one serving of alcohol is 12 ounces of beer, 4 ounces of wine, 1.5 ounces of an 80 proof spirit, or 1 ounce of a 100 proof spirit. So that would be one serving. So for men, you can have 2 servings per day, and for women, it would be 1 serving per day. Anything in excess of that would be considered too much from a cardiovascular standpoint or heart health standpoint. And then the other thing just to be thinking about is some people socially, or maybe they're not drinking during the week, but then on the weekends they're drinking a little bit more heavily. So if you're drinking multiple drinks in a short amount of time on the weekends or at any other point, that can be considered binge drinking, so that also would not be great for your heart health.
Okay. You also mentioned conditions that people may have in their past medical history that can lead to heart failure. What are some of those conditions that someone might want to be on the lookout for?
For sure. So if you were born with any type of heart defect, sometimes people don't know that they exist because they've never had problems and they're incidentally found, or maybe you do know. That would be something to talk with your healthcare provider about. If you've had a prior heart attack, that can certainly lead to a risk for heart failure. Sometimes the muscle in the heart can become weak in the area that wasn't getting good blood flow. If you have any type of heart valve disease, the most common that we see in the community are diseases of the aortic valve, so something aortic stenosis or regurgitation, or mitral valve disease, so mitral stenosis, mitral regurgitation. Diseases of the heart muscle, if you've been told that you have any cardiomyopathy, that would be something that could cause heart failure. Any type of infection of the heart or heart valves, so if you've heard the word endocarditis, and then abnormal heart rhythms or arrhythmias. So the most common one would be atrial fibrillation or something called AFib, and that's an irregular heart rhythm that causes the blood to not move as effectively through the heart. So any of those items, if you have that in your past medical history, it might be something to discuss with your healthcare provider to see if you're at risk for heart failure. Some people haven't heard the term heart failure used, but maybe their provider has told them that they have extra fluid in their body. That may still be a type of heart failure. So just having that conversation with your healthcare provider to clarify what's going on with your heart.
Sure. So if those risk factors or maybe past conditions are recognized either by an individual themselves or a doctor, how would someone then know if they actually have heart failure?
So again, it may have been found during your annual health visit, but there are some signs and symptoms that if you're having can lead to heart failure. So we're going to show you a video of some of the signs and symptoms and then discuss them a little bit.
During heart failure, the heart can't pump blood efficiently enough to meet the body's needs because either its pumping ability has weakened or because the lower left chamber has become thick and no longer holds enough blood. Without proper pumping, fluid can build up and cause symptoms that everyone should learn to recognize. Swelling, also known as edema, is most often noticed in the feet, ankles, legs, or abdomen. Sudden weight gain. People with heart failure can also track their weight to help manage any swelling. Shortness of breath is another important symptom to discuss with your doctor, especially if you notice that normal activities are getting harder to do, or that your breathing is often interrupted by persistent coughing or wheezing. You should also speak with a healthcare provider if you lose the ability to sleep and breathe well while lying down. Inadequate blood flow can also cause lightheadedness or fatigue, confusion, depression, or even fainting. Additional symptoms can sometimes include a rapid heart rate, nausea, or lack of appetite. If you notice these important symptoms, be sure to seek medical care. Know the symptoms so that together, people who have heart failure can track symptoms to help manage it successfully for a longer, healthier life.
So, as you saw in that video, some of the most common symptoms that people may have are swelling, and usually it goes with gravity, so it'll show up in feet, lower legs, and kind of move up in the body as it develops. Shortness of breath with just your normal activity. You don't have to be short of breath while exerting yourself. So just walking from your bedroom to the bathroom and you notice you're short of breath, or you can only get up 1 or 2 stairs and you're noticing you're all of a sudden short of breath. That could be something that would, kind of set off a little red flag. Maybe something's going on. If you do weigh yourself daily, which is a good health practice, to weigh yourself at the same time each day, and you notice your weight is rising and there's no really reason you can think that it should be increasing, those would be reasons to kind of reach out.
So someone maybe would recognize those symptoms in themselves, and then where would they go? Or who would they call first?
For sure. So if you have symptoms, chronic fatigue, the increased swelling we discussed, abdominal bloating, or shortness of breath and cough with just your normal daily activities, I would encourage patients to call their primary medical provider and try to set up an appointment to be seen and have a discussion about your symptoms. If you have any chest pain that's not going away, with rest, you cannot breathe or catch your breath, you need to call 911. They're equipped to be able to send out medical help to you, and that medical help can provide you services before they even get you to the hospital.
Great. That is where we're going to end for the day. Thank you so much, Alyssa, for joining us. It's been really informative.
Wonderful. And then if anyone needs more information on heart failure, our website is listed on the screen for you. And then also at the end of that heart failure symptoms video, you can always visit heart.org/HF, and that is the heart failure website for American Heart Association.
Great. Thank you for joining us on DTV today. We will be back for the next part of this failure about managing heart failure. So join us for that. Thanks.